Nurse-Related Work Injuries by Taylor Jarvis and Laura Lovett. Nurse-related injuries are very commonly seen. The nursing profession suffers the number 2 position for number of non-fatal work-related injuries in the United States.
Nursing experiences the most injuries related to musculoskeletal disorders. These musculoskeletal injuries affect the back, shoulders, knees, wrists, neck, and ankles. Other injuries may affect the skin, particularly of the hands and fingers. In addition, another area injuries may affect is the psychological system.
Musculoskeletal injuries include areas of the back, shoulders, necks, and wrists. These injuries can be due to either patient handling, such as lifting and transferring patients, or due to repetitive movements such as making beds, bringing items to patients, and pushing patients in trolleys or wheelchairs.
Musculoskeletal injuries. The average cost for patient handling injuries is $6,710 per injury, and average days lost from work is 25 days. The average cost for repetitive movement injuries is $4,013 per injury, and average days lost from work is 16 days.
A major concern related to work injuries is the major increasing number of people with obesity. Patients with obesity can increase work-related injuries due to the increased demand of work required for nurses during lifting and transferring patients. This ultimately causes more strain on the muscles. Some ways to prevent patient handling injuries can include mechanical lifting aids, assistance from another staff member, no lift policies, job rotations, and always following weightlifting limits. For males, 51 pounds, and for females, 46 pounds.
Ways to prevent repetitive movement injuries. Ensure trolleys and wheelchairs are well maintained. Obtain assistance from other staff. Select correct wheel designs for floor type.
Another area affected to work-related injuries for nurses are from falls and slips, usually affecting the knees and ankle regions. These can be caused by poor ground surfaces such as wet floors, tripping over objects on the floor, and assisting clients to and from bathrooms.
Falls and slips. The average cost for each injury is $5,420. The average days lost from work is 21 days.
Some ways to prevent falling and slipping include ensuring spills are immediately mopped up, use caution signs, ensure good housekeeping so that walkways are clear of obstacles, and use a lifter in wet areas.
Another area affected from work-related injuries for nursing are from needle sticks or punctures, usually involving the hands and fingers. These can occur when administering injections and cleaning sharp instruments.
Needle sticks and punctures, average cost per injury is $362. Average days lost from work is 1 day.
Ways to prevent needle sticks and punctures. Adhere to protocols for administering injections. Use syringes with retractable needles. Use machine-controlled instrument cleaning.
The last area that is affected from work-related injuries for nurses that is overlooked a lot is psychological, such as anxiety, depression, and work-related stress caused by occupational stressors and pressures.
Contributing factors for psychological or mental injuries. Lengthy shifts, fatigue due to standing for long periods, increased work demand due to inadequate staffing, increased patient loads due to increased lifespans, inadequate enforcement of weight handling procedures, lack of education on use of biomechanics during lifting, moving, supporting, turning, and transporting patients.
Ways to prevent psychological injuries include finding relaxing techniques to help manage stressors. This can be done by enhancing organization, asking for assistance when needed, and answering to their own needs when necessary.
Fun facts. Researchers found that almost 20% of the nurses questioned had symptoms of depression, an incidence twice as high as for the general population. The risks of a patient fall or a medication mistake increased significantly by about 20% the more a nurse was in pain or depressed.
In order for nurses to prevent from becoming a patient themselves, they need to also think about their own health needs in addition to focusing on the patient needs. Learning how to manage the two will help increase the quality of health care. As future nurses, it is important to become aware of what the major causes of these injuries are, how to prevent them from happening, and how to promote a safe working environment.